So it is true. If you consistently take a spiritual history, raise faith flags, tell faith stories, share faith prescriptions, and pray with and for your patients, spiritual opportunities will arise. Scripture promises that. And the experience of previous graduates is that that is true. And then what do you do in a time crunch when you've already got a time crunch, when you just show up at work? How do you think that through? Because if you take time to talk with the person, you may back up the waiting room or other patients that are waiting for you on the wards or in the OR. If you fail to take time, are you being unfaithful to God? How can you prepare to meet the spiritual needs when they arise, even when it's inconvenient? And a few things to think about just to erase the spiritual-physical dichotomy, to think through spiritual emergencies the same way you would regular emergencies. Develop a spiritual emergency protocol. Well, in our clinic, we have an emergency protocol, and that is that if I run into something that's going to take additional time, we have a protocol for how to handle that. I have to let my medical assistant know so that she can let people who are already roomed know we've hit a snag, we're going to be a certain amount of time. Do you want to wait? Do you want to reschedule? Do you want to see someone else? And at the same time, one of the staff is talking to people in the waiting room saying, hey, we've hit a snag, we're going to be a certain amount of time. Do you want to wait? Do you want to see someone else? Do you want to reschedule? And our administrative staff are calling people who are scheduled the rest of the morning or afternoon saying, we've hit a snag. It happens in our practices. We do that all the time. We can do the same exact thing spiritually. I had a fellow in recently who came in, it was a real short appointment to get a prescription for some arthritis meds, just NSAIDs. And so I said, I was writing the prescription, said, how's it going with your arthritis? He said, pretty good except my shoulder. He said, I've noticed my shoulder arthritis is starting to bother me when I take a walk. The faster I walk, the more the shoulder arthritis bothers me. So this morning it was particularly bad. In fact, normally I can sit down and the shoulder arthritis goes away, but it didn't this morning. But not only that, my GERD acted up. I got this heartburn. And I had an asthma attack at the same time. I got short of breath. I said, I'm getting short of breath here. Have a protocol. You know, we're going to be delayed here. We're going to get an IV. We're going to get some aspirin. We're going to call 911. We're getting an EKG. Boom. If I hit a spiritual emergency, it's the same thing. I have a protocol for dealing with that emergency, and you need to sort of think through the same thing. But it's critical to have a spiritual referral network, that when you run into things that you're either not trained or experienced to handle, or you just don't have time to handle, or you don't have permission to handle in the particular institution with where you work, do you have people you can refer to, that you can call in, pastoral professionals or pastors that you know your pastor, Christian counselors that you might be able to call, lay ministers. We'll talk in a few more minutes about lay ministers, but others that you can invite into this work, that you become sort of a triage point in the healthcare system to referring people to others, and then to prepare yourself. You may want, there's situations where some practices will reserve clinic time just for spiritual counseling, and they'll have time where people can come back for that. Perhaps there'll be non-clinic time that I'll have times where I will invite a patient to have a cup of coffee or to have breakfast. Always same gender patients. If not, if it's a woman, then Barb will join me or another female will join me. But perhaps the most important part of preparing yourself is to have around you a spiritual care team, to be part of a spiritual care team. We're going to spend the next few minutes talking about that. But is it really an emergency? Or are you the best one to handle it? And how will your decision affect others? I mean, if it's really not an emergency, then can you refer it? Or can you reschedule it? In our next session after lunch, we'll be sharing a testimony from Randy where he's got a new patient that comes in, and she shares a very significant piece of spiritual information. He doesn't have time to handle it at that moment. You'll hear how he very skillfully deals with that situation. If you're not the best one to handle it, or you can't handle it, or you don't have permission to handle it, refer it. But how do you do that? How do you figure that out in your system? And if it's not the best time, fine. Reschedule it. maybe it's going to be later in that shift, or maybe it's going to be the next time you see the patient, or maybe it's going to be on down the line. A number of principles for spiritual emergencies are outlined in your textbook, but I want to spend the rest of our time before we break for lunch talking about a concept that we've been teaching for 20 years that's now been really nicely outlined in the medical literature on the concept of a spiritual care team. And Harold Koenig at Duke has done a really nice review article on this topic, and it is included in your workbook. It's the last reference article in your workbook. The whole thing is there, along with a tiny URL if you would like to copy it to run off additionals. But the concept of a spiritual care team has been in the literature for a couple of decades. We've been teaching it in saline solution and Grace prescription since the mid-1990s. And it's been one of the principles that people have been able to utilize to dramatically increase their effectiveness in care. It's now being taught and developed at the Duke University Center for Spirituality, Theology, and Health, and is being implemented this year and next year in every Adventist hospital in America and every Adventist outpatient clinic in America. But it's a system that's not just for Christians. It's a spiritual care system. And the goal of a spiritual care team is to identify the spiritual needs of patients related to their illnesses, and then to competently and ethically address those spiritual needs. We're talking about secular institutions, urban institutions, faith-based institutions who are building these teams for reasons that we talked about yesterday. Thirdly, to create an atmosphere where patients feel comfortable talking about their spiritual needs with the team members, and mostly to provide whole person health care to all of the patients that we see on an institutional or team or office basis. In outpatient situations, this team is headed by a healthcare professional attached to a spiritual care coordinator. This could be a nurse, it could be a clinic manager. In some situations, it could be your spouse or a lay minister or a pastoral professional. And then attached to that, chaplains, pastoral professionals, lay ministers, perhaps even administrative staff can begin to become part of the spiritual care system, particularly praying for patients. And we'll talk about that in a later session. In inpatients, a spiritual care team is headed by a healthcare professional attached to a spiritual care coordinator. In hospitals or large clinics, this could be a nurse or a case manager or a clinical manager. And then other members of the team can include pastoral professionals, chaplains, lay ministers, social workers, case managers, receptionists, ward clerks. Other staff can be attached. But the idea for us as healthcare professionals is that we realize not only the opportunity that we have, but the responsibility that we have to not only meet our patients' needs, but to develop around us others who will join us in this great work to which God has called us. And our primary responsibility in this institutionalized type of spiritual care team is to do the spiritual assessment. That allows us to find out where people are in their spiritual journey, to find out what needs they have, as the Joint Commission says, if any, so that we might be able to join them on their journey. And then document that in the record, to document the spiritual assessment, elaborate on any of the yes answers as we talked about in our spiritual assessment sessions last night. And then for spiritual needs that are recognized, for us in our busyness, to involve the spiritual care coordinator, our assistant, if you would, our partner, our co-minister, to begin addressing those needs. So the key connection here is you and someone else who can join you in this great work, a spiritual care coordinator. Like I said, it could be a nurse, clinic, office manager, sort of if we're the quarterback, if the healthcare professional is kind of the quarterback of doing the spiritual assessment and recognizing these needs, then the spiritual care coordinator can kind of become the coach if you would. And there's a number of duties. There's about 10 of them listed in the article. I'm just going to review 3 or 4 of them at this point. But the first is to be sure we're doing our job of taking our assessments. This is our accountability partner. Judy's not here this morning, is she? But so she's kind of the one to be sure there at Beacon that you guys are doing what you've committed to do. So they're sort of our accountability partner. They are not the person to conduct the assessment. We need to do that. And the main reason is because the literature shows that religious struggle tends to only be discussed with the health professional. And then the spiritual coordinator can review the spiritual history, identify any of the needs, and begin to put together mechanisms of dealing with those needs to help be sure that patients' needs, spiritual needs, are addressed and followed up. Just a few examples. The spiritual care coordinator can let the patient's faith community know that they're being taken care of. For example, under HIPAA regulations, it used to be that when someone was admitted to a healthcare institution, that the institution would notify the patient's faith community that they were there so that the pastoral professional, the priest, the rabbi, the monk, could make the visitation the next day. They cannot do that anymore. But we can be a stimulus to be sure that the institution is notifying the community, for example. If people desire spiritual reading materials, if they want pastoral care services or chaplain services, or if they want prayer, a spiritual coordinator can help coordinate that. A study done in Chicago, Urban City Hospital there, showed that the average patient named 3 spiritual resource needs at admission, none of which were met by the institution or the healthcare professional. And the spiritual care coordinator can provide prayer with and for patients, coordinate prayer for patients or prayer resources. And there's a whole bunch of additional potential duties that are outlined in the article. And it also discusses the potential opportunities that other team members have. We don't have time to go into those today, but I did want you to at least be aware of this information, and for those of you to whom this would fit your practice situation, to be able to read this article and begin to talk about how do I involve a person like this with me that can help us begin to build a spiritual care team where I'm at. We were really gratified in a recent Grace Prescriptions conference to hear back from a group of students, one group of nursing students and one group of medical students, who did this as students in their institutions. And in one case, in the nursing students, actually have stimulated the institute, the actual hospital, to begin thinking about, gosh, we can and should do this. We can have an effect. So you've got the health professional connected to a spiritual care coordinator who begins to develop resources of bringing in pastoral professionals who can help in our busyness to meet patients' spiritual needs. This could be hospital chaplains, workplace chaplains, local pastors, priests, or rabbis. I will tell you that some chaplaincy services are very evangelical and biblical, and some not so much, but being aware of your particular chaplain service. Some of you are in institutions that may be able to use a workplace chaplain, and there are 2 organizations listed in your workbook that provide chaplaincy services for clinics, healthcare institutions, workplaces, so Marketplace Chaplains and Corporate Chaplains of America. Perhaps you and other practices can combine together to have a chaplain. Perhaps your pastor, perhaps your church has pastoral services that would be available. We, in our practice, went to every pastor, priest, and rabbi in our town over a period of several months to ask them, if we have people of your denomination or of your congregation who need services, would you be willing for us to call you? Not one said no. The one that came closest were 3 little Buddhist monks who had set up a temple in town. This was a little country town, and boy, did that get the cowboys talking when they set up their temple. But we went to them and asked if they would be willing to be part of our pastor care team should any of their congregants come under our care. And the head monk, she was a very small woman, but she said, why would you do that? Why would you come to us? And I said, well, why wouldn't we? And she said, because everyone knows you're Christian. And I said, well, everyone knows you're Buddhist. And I care for Buddhists. And I care about Buddhists. And I remember the first patient, the first congregant of theirs that came into the emergency room with acute cholecystitis. She had a common duct obstruction. We did not have basket services or interventional radiologists at that time. So our real option was an open surgical case. So I called the surgeon, and the surgeon came in, evaluated her. She's scheduled to go to the OR. And then I found out with the spiritual history that she was attending the Buddhist temple. And so I called one of the monks, and the monk came in. And I want to tell you what I remember about that experience. I was filling out the pre-op forms. We were in the pre-op area, and I remember the monitor of her heart rate. Doot, 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 doot. And those of us who do intensive care or OB care, we know, doot, 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 160 beats per minute, doot, 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 120 beats per minute, doot, doot, 60. You just know that, And she's tacking along at 120, 130 beats per minute. And I'm not really thinking about it. I'm just filling out the forms. And in walks her monk. And we greet each other, and the monk walks over to spend time with her congregant. They hold hands, and I don't hear what they're talking about, but I do remember the heart rate slowing down and down and down. It was beneficial for her to have her pastoral professional. That woman came to Christ about 9 months later. She attributes the beginning of that to my care of connecting her to her pastoral professional, to meet her where she was at in her spiritual journey and help her take how many steps? One step onward. Besides pastoral professionals and the spiritual care team, many of us are in situations where we can consider lay ministers using non-licensed people. My mentor, Dr. Paul Brand, Sir Paul Brand said this, in the active practice of our profession, we need to know and have available to us, on call as it were, other people who can participate with us in the great work of witnessing to the love of God. I believe we should know people in our church and in our hospital, nurses, mothers, people who have been bereaved, people who have suffered, people who know how to sympathize and comfort, so that in our busyness, when we cannot give as much time as we ought to give, we can call on someone else to help. It would be wise to have a list of other members of the body of Christ who could help us in this great work. We use in one clinic that I'm involved with a lay minister training system that was developed by Sherry O'Donnell and Dan Fountain. It's a 29 one-hour sessions, training videos, on how to be a lay minister, either in an institutional healthcare situation or in an office situation. And the information on contacting Sherry, Dan's now passed away. He's graduated to glory. But Dan was a surgeon, Sherry's an intern. And it's a wonderful system. Also, Stephen's Ministries equips and empowers lay caregivers called Stephen's Ministers to provide high-quality, confidential, Christ-centered care, either in an office or a hospital setting, for people who have spiritual needs. And their contact information is in your workbook. If you choose to utilize lay ministers with you in care, non-licensed people, there's some things to think about. Competency, background checks being part of it. Confidentiality, that they understand HIPAA regulations, and it's just different, as you know, in the healthcare environment than anywhere else. Culpability, that you need to be sure legally that it's okay in the system you work with, and you want to be sure that you have same-gender care given. And lastly, you want people who are compassionate. For our lay ministers, we only use people who are recommended by a pastor and who are active in a local church. And the reason is we want to have accountability in case there's any sort of corrective action that needs to be done. We want to be sure to have a pastor involved. So Solomon tells us in Ecclesiastes 2 are better than one because they have a good return for their labor. If either of them falls down, one can help the other up. But pity anyone who falls and has no one to help them up. Also, if two lie together, they'll keep warm. But how can one keep warm alone? Though one may be overpowered, two can defend themselves, and a cord of 3 strands is not quickly broken. So you've seen this verse several times before. Devote yourselves to prayer, being watchful and thankful, grateful. and pray that God may open a door for your message so that you may proclaim the mystery of Christ. Pray that you may proclaim it clearly as you should. Being wise in the way that you act towards outsiders, making the most of every opportunity, letting your conversation always being seasoned with salt so that you will know how to answer everyone who asks. So in the last few minutes before lunch, we'd like you just to take some time with the Lord and just on page 66, begin to think about, as I quickly didn't regulate the dose, but gave you information quickly, did names come up of people that you might want to contact who might be part of your team? For some of your students, maybe it's just your pastor. For others, it may be other people. But take just a few minutes to jot down some people who may be part of your spiritual care team